Avaya has changed my life.
Avaya has made me the woman I am today.
Avaya is my home.
Avaya is personal freedom.
Avaya is the reason my life continuously improves.
Let everyone in your life know about Avaya.
Everyone needs to know about this amazing company.
Thank you, Avaya, for appearing in my inbox.
What Ike Allen and Andy Anderson have created at Avaya is what the world needs.
Hello, Avaya family. I'm Andy Anderson. My partner Ike Allen and I are teachers, mentors, and the co-owners of Avaya University. Avaya is the creator of over 1,000 books, films, courses, teachings, and other supportive materials. Thank you so much for joining us. Our fellow teacher, Dr. Jeremy Lamb, is with us today to talk about whole body's response to stress and how to heal from it. Dr. Lamb is a board-certified physician in internal medicine, anti-aging, and regenerative medicine. His career mission is not only in treating chronic diseases, but reversing the disease course. He focuses on preventative medicine and utilizes both conventional, traditional medicine, along with functional and integrative approaches to treat the whole person. He is part of Lamb Clinic, a team of physicians and health professionals who have well over half a century of combined clinical experience in the power of natural healing. Welcome to Avaya, Dr. Lamb.
Hello. Hi, Andy. Thanks for having me.
Yeah, great to meet you and great to have you here and talking about a very important topic today. So let's dive in. So since we're going to be talking about adrenal fatigue today, could you start us off with what is the difference between adrenal fatigue and chronic fatigue?
Well, in conventional medicine, chronic fatigue syndrome is actually a diagnosis where you have to meet certain criteria in that aspect to get diagnosed with chronic fatigue. And so that's quite different than adrenal fatigue, where it's actually a subclinical condition. Unfortunately, it's not recognized by conventional medicine or in that standpoint. So that's really the difference there. But overlappingly is actually quite a lot of the similar symptoms. Obviously, feeling very tired, fatigued, not being able to get through your workday, having this brain fog, mental inclarity, sometimes even short-term memory problems. That's what we see a lot of. And it's basically this constitution of these vague symptoms where you go to doctor, they tell you, work this up, do EKG, do your hormone testing, test your thyroid, and everything comes back normal. But unfortunately, your body doesn't feel normal. And so then that's when we hone in into both chronic fatigue as well as adrenal fatigue, and really honing in on really trying to get down to the root cause of those issues.
Gotcha. Awesome. Thank you for clarifying the difference between those. So since our conversation is going to center a lot around stress today and how this relates to everything, could you give us, I guess, a little brief overview of how does stress impact our physical health? How does it impact something like adrenal fatigue and other conditions?
Well, stress can be both mental, physical, emotional, psychological, all that we know. And our bodies were made to encounter stress, but it was made to encounter just acute stress, right? So when we were hunters back then, we would go and encounter a lion, we would fight off the stress, and then we would come back and we would rest. Now, in today's modern world, we have chronic stress, social media, the news constantly, all these negative things going on, work. So our bodies weren't made for chronic stress. And when you do encounter chronic stress, your adrenals actually start to break down because adrenals are an anti-stress organ. So it puts out the anti-stress hormone cortisol. And we've all heard about cortisol before, similar to steroids, right? So it helps to balance your immune system, decrease inflammation, helps control your blood sugar, blood pressure, all of that. So in chronic stress, your adrenals are going to either try to put out too much cortisol, or maybe it's faltered and you don't have enough cortisol to put out. And that's when all these issues can come forth, both from too much as well as too little cortisol. So that's one component in how the adrenals help deal with stress. Now, all your other organs and circuits as well help deal with stress. So we've developed actually a neuroendometabolic stress response where you have 6 circuits and you have 12 organ systems and how your body responds to stress. Because the adrenal still is only responsible for some symptoms, but let's say anxiety, insomnia, that's part of your neural affect circuit. If you have high blood pressure, if you have heart palpitations, that's part of your cardiovascular circuit. Along with maybe brain fog, joint aches, then your body's more inflamed, or maybe you have a problem with your detoxification circuit. So overall, it's not necessarily just focusing on the adrenals, but more of looking at the whole body and letting us know, and letting your body actually let us know what is the dominant circuit that's involved, how it's responding to stress, and then we deal with that circuit.
Okay, gotcha. So out of curiosity, like when do you see most people, right, being diagnosed, I guess, so to speak, with this kind of chronic stress, adrenal fatigue stuff?
So it can be a wide variety here, but mainly we see them when they've gone through the conventional workup. Again, like I said, they start feeling tired. You've had your thyroid checked. That comes back normal. Oftentimes, even if a lot of our patients are on thyroid medications, but then you keep going up in your dosing and yet you're still feeling tired, then we're starting to look for other questions here. If you start having heart palpitations, heart arrhythmias, then your adrenals are much more affected in that case. Also, much more on our deeper end patients, they end up actually being bedridden, they're crashed, and they've gone through conventional medicine. They've gone to the ER multiple times, and no one can really give them a good answer on what's going on. And so that's when we start to really have people start reaching out to us, because we're kind of a doctor of last resort where no one else has the answers. So then they come to us and we get them better.
Gotcha. And is there like an age that this is more typical? Is it older adults? Do you see this in younger people too?
So it used to be much older. I mean, we started, and my dad, right, actually had adrenal fatigue, and that's when we started. He started it in maybe his late 40s. And so we've been doing this for over the past 10 years. And we've been finding actually that more and more younger patients are coming in with adrenal fatigue. Normally it's, again, females that are older, but now both males and females maybe are being affected as well. Again, it's not necessarily age specific, but more of a body constitution. So if you have more genetic mutations, if you have other issues like gut issues, if you've been on antibiotics before, then your body is much more stressed compared to other people. And so you can get suffering from an early age as well. If you also had maybe trauma earlier on, assault, accidents earlier on, then we do see them maybe more in their 30s. We do see quite a few patients still in their 30s, 40s, and 50s as well.
Gotcha. Awesome. Thank you.
Yeah.
I appreciate you clarifying that for people. And a minute ago, Jeremy, you mentioned, now let me see if I can say this properly, neuroendometabolic medicine. So, right, these different circuits, I think. So what is neuroendometabolic medicine, and what does this look like in patients that you see?
So with that, it would be easier if we have our chart here. But again, with this chart in the middle is stress. And so stress affects different circuits in your body. So there are 6 circuits. There's your hormonal circuit, your cardiovascular circuit, and your neural affect circuit. And so that's on the neuroendo side. And then the metabolic side, again, is the inflammation, your detoxification, and your bioenergetic. Now, we use these as circuits to kind of break down how your body is responding to stress and what symptoms pop up from there. So like I said, you have gut issues. If you have bloating, constipation, then that's leading more towards the inflammation in your gut circuit. If you're noticing that you have more depression, anxiety, then we do know that your stress is affecting that circuit more. So then we will work more on your brain, on your neurotransmitters. Again, if you find that you have more hormonal issues, maybe irregular periods, fibroids, breast cysts, PCOS, things like that, then we would hone in more on the hormonal circuit. And now the hormonal circuit, each circuit has 3 organs. So for example, the hormonal circuit is both the reproductive organs, so your testes or your ovarian, the adrenal gland, and then the thyroid. And so that's clearly, there's a correlation there in the hormones with your OAT axis. So we focus on that a lot. And that's how we really address the whole body. So it's not necessarily only the adrenals that's a component, because let's say, you can have adrenals, but your main symptom is just you can't fall asleep. We see a lot of patients like that waking up at 2 a.m., can't fall asleep. Then there's something else underlying that we address. And so that's kind of our approach to the whole body.
Gotcha. Here, quick question for people who don't know. Where are the adrenals?
The adrenal glands are actually two organs. They sit on top of your kidneys, and they're actually in the stomach area, in your abdominal. So a lot of times, actually, we do see people with weight gain around the center. And you diet, you exercise, you do everything that you can, and you can't lose this muffin top that we have. Now, oftentimes that can be from the adrenals because the adrenals are in your belly area, right? So when your body's under stress, this is going to signal to the adrenals, hey, I'm stressed. I need to hang on to all my fat because how do you make cortisol? How do you make hormones, estrogen, progesterone? All that is from cholesterol and fat. And so where does this fat go? It actually sits in your belly area because that's, again, where your adrenals are. That's also where most of your cortisol receptors are as well as in the belly. So oftentimes we have these patients who come in, again, they exercise, they diet, they're eating only like half a meal a day, and then the weight is still not budging. Because sometimes that's actually overstressing the body even more, right? Just eating 300, 400, 500 calories is not healthy for the body. So then we work on the adrenals, try to find the underlying problem. And then my patients say, hey, actually, once we work on the adrenals, I'm not even exercising, I'm not even dieting as well. And yet I'm finding that my weight is actually shedding off because we address the underlying problem there.
Gotcha. Awesome. Thank you. I appreciate you sharing a little bit more about like where all this stuff is for people who might not understand it or know what's going on. So let's talk a little bit about like different styles of medicine, so to speak. So, right, you talk about integrative, functional, natural medicine, and then, right, there's also conventional medicine. So what is the difference between all these?
Well, I mean, conventional medicine is, I mean, I'm Western trained as well. So we're used to just drawing labs. And then if your labs are outside the normal range, then we would give you medications if there is. From a conventional medicine standpoint, there's not really much we can do with chronic fatigue. Again, just give you thyroid or hormone replacement if that's the case. Try to put you on an antidepressant, and that's pretty much it, I would imagine, as I've gone through that with my patients. And it was quite a struggle, right? Not seeing the medications improve, seeing patients keep coming back and not really having any solutions. So with that then is functional medicine, where we actually try to find out the root cause of the issues. Again, so doing more specialized testing, we do saliva testing to see cortisol, as your cortisol trend rises in the morning, drops down low at night. So you need to do it throughout the day. Also test for free hormones. Testing for heavy metals, as that can be a chronic stressor. Testing for mold, for micronutrient testing. That's all trying to get down to the root cause. And then integrative medicine is kind of approaching both conventional as well as natural medicine. So using supplements as necessary and using medications also if necessary. So oftentimes, again, we see a lot of our thyroid patients. I do have them on thyroid medication, but then also supplements to help so then they can actually start weaning down on their thyroid medication as tolerated. And the goal is to be off of medication, right? We want our body to be able to be on natural things, to be able to provide its own nutrients, and ultimately also not be on too much supplements, as your body can recover on its own. Mm-hmm. So that's the different approaches that we do. So then I practice both integrative, functional, conventional, all of that, and just having more tools in my toolbox, basically, to be able to treat the patient in front of me.
Yeah, gotcha. Awesome. Thank you. I appreciate that. And you mentioned, I think when you were talking about functional medicine, right, finding the root cause. What do you see as the root causes for things like adrenal fatigue? Like, what are some examples of what that it could be?
Right. So chronic stress, definitely one. So we do tell people their lifestyle needs to change. All of type A patients, type A like personalities tend to deal with adrenal fatigue. So we work on the lifestyle. We do other investigations, so like heavy metals. Now, just because you're not working around like metals or things like that doesn't mean it's not around. So a lot of our patients are surprised. We find mercury, lead, titanium, nickel that's in their body, and your body shouldn't have any of that. That can be from pesticides, from cooking pans, from pipes, from waters, things like that. We also do mold testing. We do micronutrient testing if your gut is not absorbing things well. If you're not absorbing the nutrients well, that's causing your body to be much more stressed. So SIBO, leaky gut, things like that. Also testing for genetic conditions. So something like MTHFR, where your body can't recycle your hormones properly, can't detox your body properly. That's also underlying problem. And those are just some of the common root causes that we do investigate further into.
Gotcha. Awesome. Thank you. I appreciate you diving deeper into that. So given all of this, right, if someone has adrenal fatigue, chronic fatigue, dealing with a number of other things, like how can people actually heal naturally?
So number one, again, is just decrease your stress level. I know that's very hard. Try to turn off the news, turn off that social media if you need. Try to get good sleep in that aspect. Number two, then, is do the investigatory testing. You need to still go through that conventional route. Test your thyroid, test your hormones, make sure your heart's okay. Nothing else can be the underlying problem. Then we embark on a journey to give your adrenals the nutrients that it needs to be able to make more cortisol, to be able to balance itself. That includes, vitamins, herbs, adaptogenic herbs, sometimes even hormones, DHEA, pregnenolone, testosterone, estrogen, progesterone. Sometimes that's also needed to help balance the axis. And then after that, weaning those off as we've kickstarted your body to be able to help boost and support its own adrenals. And then just right there, then being on a maintenance dosing. And we normally do this from a coaching, from a standpoint where we follow up with the patients every 2-3 weeks. If the body's more stable, we do it every month. And then ultimately listening to what the body tells us. Sometimes they say, hey, I'm getting too anxious, so then we need to cut back on some of the vitamins. Maybe they're saying, hey, I'm getting diarrhea, or I get more brain fog. Then we need to maybe work on detoxing the body first before we introduce other things in. So it's ultimately really letting the body send the signals and its whispers to us, the practitioner, as we've experienced with listening to the body, and then we get the body doing much better.
Mm-hmm. Gotcha. Awesome. Thank you. Any thoughts around diet as it relates to, I guess, just overall health, adrenal fatigue, a less stressful diet for the body?
Mm-hmm.
Any thoughts there?
Well, definitely trying to cut down on some of the inflammatory foods is always important. So less like oils, trans fats, things that are going to cause inflammation. I like to think of it kind of as you have a non-stick pan, right? And so when you eat food that is much more inflammatory, it's going to actually crack kind of the pan. When you crack the pan, actually it's causing cracks also in the blood vessel. And so that's where cholesterol is actually going to stick onto. So same thing with inflammation in general. So things like dairy, gluten, soy, and eggs, we tend to do an elimination diet to see if patients do feel better in that. Sometimes elimination diets are also very hard to complete. So doing food sensitivity tests, right, where you can test for over like 200 different foods, that's also a possibility. And then definitely cutting out on junk food, fast food, alcohols. Oftentimes, we should decrease that amount as well. And that's the main approach. Oftentimes with patients who are much more sick, with the adrenal fatigue, because your body is in a catabolic state, we also recommend smaller, frequent meals. When your blood sugar actually spikes up and down, that causes more stress on your body. So eating a lot of like carbs, rice, that's very stressful in your body. So eating small, higher protein, keeping your blood sugar more sustained, that's something else that is recommended for some people.
Mm-hmm. Gotcha. What about caffeine?
Caffeine, we all need that to get up and to get going. Now, again, if you need caffeine, your body shouldn't need it, right? So if you're needing that coffee to wake up, that's already in the early stages of adrenal fatigue. So with that, that's your body's sign of already telling you, hey, something's going on, but we're just patching it with coffee and caffeine. And then we'll notice that, hey, I need 2 cups more, I need 3 cups just to get the same effect. So with that, caffeine, not good, but if you need it, I mean, don't stop cold turkey either. You need to wean off eventually.
Gotcha. I ask you this as I have my cup of coffee next to me,
Is
but
it decaf?
it is not decaf. No, it's not. But I had to ask. I figured that's a good question in the world of stress and adrenal fatigue, obviously. So okay.
Right. Yeah.
What about exercise? So obviously exercise is good for the body in all these ways, but you don't want to overdo it and overstress your body. So any thoughts there?
Yeah, so with exercise, again, it depends on what stage and where you're at. If you're earlier on, doing exercise is fine. But again, in our late stage patients where they're very fatigued, bedridden, we don't want to stress out the body even more. And so we tell patients actually don't raise your heart rate more than 100, 110. And again, it depends on what stage of adrenal fatigue you're on. So it's really taking, again, a personalized approach. Sorry, I can't give you like a more generalized answer because each patient is just so different. And so it really takes understanding where their body's at to recommend even if exercise is good or bad.
Mm-hmm. Okay. Gotcha. Yeah, no, that's good so everybody watching, obviously totally individual based on where you're at. Okay.
Yeah.
Good to know. So you kind of touched on this a little bit, Jeremy, already, but you talked about thyroid, adrenals, and or reproductive organs that could be causing symptoms. So how does one know the difference? Like, how do you know where it's coming from?
So again, let's talk about maybe how your predominant circuits and your symptoms show up. So in hypothyroidism, weight gain, you can have cold extremities. You find your heart maybe a little bit slower, fatigued, eyebrow thinning, things like that. But ultimately, it is very hard to kind of tease what the underlying problem is. Oftentimes, again, if we check your thyroid and your thyroid is actually hypoactive, we still want to ask the question on why is your thyroid hypoactive? Is it because of antibodies? Is it because something else is telling your thyroid, hey, we actually need to slow down. We need to slow down our metabolism, maybe because we're encountering stress, maybe because we need to focus more on our reproductive organs first. So with that, in my experience, all comes back still to the adrenals. Again, because we find that the adrenals tell the thyroid, hey, again, I'm encountering stress. I need to hibernate. I need to conserve all my energy. So by doing so, we check your thyroid labs, and then your thyroid labs actually end up being low, and you get put on thyroid replacement. But that's just patching the symptoms. Again, when your body's under stress, it's going to say, hey, let me decrease my hormones. Reproduction is not important, right, when I'm fighting off this lion. So with that, then your hormones start to be imbalanced. You might have estrogen dominance with a progesterone deficiency. Then that leads to PCOS, that leads to irregular periods, that leads to PMS and cramping. So oftentimes it all hones back down to the adrenal glands. And when you get that better, you'll find that everything else will rebalance.
Gotcha. Awesome. Thank you. Appreciate you going through that. So I'd love it if you'd share a little bit about, your clinic, you have your family and your clinic and how, what's your mission, right? Like how does your clinic plan to change the future of medicine?
Our clinic here is in Tustin in Orange County. We're just 20 minutes from Disneyland here. And we've been doing nutritional coaching for the past 10 years. And then we started to actually see that these patients need a lot more help, not only with nutritional coaching, but really medical diagnosis as well. So with this clinic, our goal is to really approach medicine from, again, the integrative and functional approach. Our clinic here is very different because we do accept actually healthcare insurance. So you'll find that most people who are practicing integrative functional medicine, it's not really that feasible, right? Because we want to do in-depth testing, you want to do long appointments, things like that. And so it's mostly cash-based. So our goal is actually to bring integrative and functional medicine to just the world, to be able to affordable to the general public, not just those people who have money, because everyone deserves this kind of health, deserves to really get in tip-top shape and really again, understand their underlying problems. And even not just if you don't even have any problems, you deserve to have good preventative care. So we do a lot of screening, we do a lot of advanced blood testing, cancer screening, things like that, to make sure that your future health is already in tip-top shape. By the time that your labs come back that are abnormal, that's already one step too late. So we want to catch diseases before they come on. And so that's really our goal, is to bring integrative functional medicine to the world, so then everyone can really experience this, and not only just cash or affluent patients, but really everyone.
Yeah, I love that. Thank you for that. Thank you. And everyone who's at the clinic with you, because that's just so key and so important that we get something other than just conventional medicine, I think, into the, lives of people, lots more to work with there. So
yeah.
That's awesome. So Jeremy, I'd love it if you'd share a little bit about the gift that you have for everyone. And there's a button below everyone watching or listening that links over to Jeremy's site. So what do you have for us?
So we are going to be giving the free adrenal fatigue starter kit. Okay. And so this includes both our adrenal fatigue syndrome ebook, which has 500 pages. Is going to be a very in-depth book on describing both what the adrenals do, kind of your approach to recovery as well. And this is can help as self-guidance, but ultimately it's still best if you read that along and then still, get someone that can help you along this journey, because it's a very tedious roller coaster, definitely journey. And so you want someone who's experienced, who can walk you through this. Ultimately, when you're dealing with your own body, you don't want to experiment with that, right? So you want to make sure you get it done right, you get it done once, and then you get your vitality back. What else is included in that starter kit is our adrenal fatigue syndrome cookbook. So with that, it's going to give you recipes to reclaim your energy, recipes to help you recover from your adrenal fatigue as well. So both those books will be in the starter kit. So I encourage you guys to go get it. It will only help in your recovery journey.
Awesome. Thank you for all that. That's such great information, and a big book too for people to dive into. I love that. Thank you. And again, everyone, that button's below that links over to that, so you can grab that. And any last insights, anything else you want to talk about or touch on before we wrap up, Jeremy?
I think just, remembering that, again, you want to always ask the question, why? So if a doctor tells you, hey, you have this going on, then ask why. Like, why is my blood pressure high? Why is my cholesterol high? Never just stop at saying my blood pressure is high, let me take this medication. But again, trying to dive into the question why, that'll really help benefit your body and your future as well. And thank you for having me here.
Awesome. Yes. Thank you so much. This has been great. I really appreciate you taking the time and educating us today on this topic. So appreciate it.
Thank you.
Thank you. And thank you, everyone, Avaya students watching or listening, for showing up for yourself today on this journey. And we will see you all again very soon. Take care. Hey, everyone. Thank you so much for joining us for this latest class with Dr. Jeremy Lamb. He talked with us today about a whole body's response to stress and how to heal from it. I really enjoyed this conversation. I love that we have this conversation as it relates to stress, and really talking about how mental, psychological stress, which was the bulk of our conversation, right, can impact our physical body and lead to things like adrenal fatigue, chronic fatigue, autoimmune diseases, all sorts of things that we really didn't discuss today, but primarily that adrenal fatigue. And right, what are some things you can do to heal from it? And I always love when anyone in the health field talks about, right, what the core problem is, what the core issue is, and starting to tackle that, as opposed to just putting a Band-Aid on something. So I think that was a really great explanation of the impact of stress and what can we do about it? How can we obviously decrease the amount of stress in our life, and do different forms of self-care? How can we incorporate different foods, anti-inflammatory foods into our diet, take out more inflammatory foods? How can we do the right kinds of exercise for our unique body, recognizing that we are all different in that way, and we're all going to need something a little bit different from one another. So just recognizing that. So thank you so much for tuning in, for joining us for this latest class. We'll see you again soon. Take care.
Avaya has changed my life.
Avaya has made me the woman I am today.
Avaya is my home.
Avaya is personal freedom.
Avaya is the reason my life continuously improves.
Let everyone in your life know about Avaya.
Everyone needs to know about this amazing company.
Thank you, Avaya, for appearing in my inbox.
What Ike Allen and Andy Anderson have created at Avaya is what the world needs.